Okay, so I'm going to just talk for a few slides. I'm the epidemiologist working with Curtis and Jenna and Mary and Aileen. And they wanted me to talk about the data part. I hope you can hear me. I have a really soft voice.
Yeah, you might want to move to the middle then if you're a softer voice.
Yeah.
That's better anyways. Maybe they'll be able to mute you.
No, we turned off. Now we're looking at we're looking at the slides.
So basically, about 5 years ago, the WHO and the Surgeon General and CDC all recognized a need to incorporate monitoring of social determinants of health into our routine public health monitoring. And they've been developing over the past 5 years these resources to support people to collect, analyze, and report data on social determinants of health. And this is an example of a website from the CDC. And if you follow the links here, if you click on this sources for data, you get lots of resources like lists of variables, things you can measure to track social determinants of health, lists of data sets that have county-level information. You click on this other one, tools for putting social determinants of health into action. There are resources like papers discussing the issues of analyzing the data and how you might need to link across different data systems or analyze at the area or aggregate level. And so this is the context we're working in. What do we have?
Hello? You're cutting in and out. Could you get closer to the phone, please? I can barely hear you. Sorry.
Yes, I'm right next to it now. Is that better, I hope? Okay, so for MCAH monitoring, but I have this grid now up, and on the left column is a list of data sources that MCAH frequently uses for monitoring. So vital records, administrative billing data, screening data, or survey data. And then the columns that are going across are types of social determinants. And if we had fully integrated social determinants of health in our public health monitoring, there'd be lots of X's on this table, and you can see that we have some work to do in order to integrate that. But we do have some X's on the table, so there is something we can do already with the data that we all have. And the sources I have listed here, all the counties have access, at least California counties have access to these sources of data. And these are just general buckets of social determinants of health, and the types of information available are limited. So for housing and the birth records, we have address, and you can use that to link to lists of public housing or lists of SRO to get a little information about type of housing, and then neighborhood, obviously. And so the next few slides that I'll go through really quickly are just some examples of what we've done with the kinds of data that are available. So this data shows preterm birth by housing type, and we reported that women living in public housing, single-room occupancy hotels, and shelters have higher risk of health problems during pregnancy and preterm birth than women in standard housing. We showed this slide to the Preterm Birth Initiative group, and this has resulted in targeted intervention plans for SF Hope housing. Here's an example of data shown by Delivery Hospital. We have significant race-ethnic disparities in breastfeeding, and when we look at the race differences by hospital, delivery hospital, you can see that some hospitals are doing something that's working. So it gives some direction. We've presented this to the Women's Health Advisory Council, and that has stimulated queries into clinic-specific prenatal education and resources. This is an example of data of postpartum leave by income, and this is data using American Community Survey data. And there's a lot going on here, but what you can notice is that the higher income moms, there's some yellow in the bars, and that represents they have a job, but they're on leave. And these are women who are postpartum in that first year postpartum. In the lower income women, there's no yellow. We showed these data to the Healthy Mothers Workplace Coalition, and they are using it to help their work to address leave disparities. This is an example of child weight change by Child Care Center. We showed these data to the Children's Nutrition and Physical Activity Collaborative. Basically, you have some child care centers where no children became overweight or obese during the school year, and that some of the children who enrolled overweight or obese actually improved their weight status during the school year. And that's in contrast to these other child care centers where you have children becoming overweight during the school year and not getting better. So they are using that to target support to these child care centers over the year. One more example is Carrie's experience by neighborhood. These data were presented to the Children's Oral Health Collaborative. They resulted in a lot of action, neighborhood briefings, media coverage, creation of community coalitions, neighborhood-specific coalitions, and they've allocated different kinds of funding and gotten grants to go after this map. So that's all I've brought, and I'll give this back to Jenna.